Are you troubled with your snoring? Snoring is not just a noisy problem, it may have repercussions on your health. Please keep watching this video to know more. Now, I am Dr. Saurav Gupta. I am an ENT surgeon. Now, snoring is not just a noisy breathing. Snoring happens when you sleep and your soft palate and your oral cavity soft tissue start vibrating because of the narrowed airway. Now, there can be many causes of snoring. It may be due to overweight, it may be due to having a short neck, or you may be having a nose problem, or you may be having an alcohol dependence. But snoring as per se is not dangerous. But if the snoring obstructs your airway and decreases your oxygen supply to your brain, your sleep at the night will not be good, and you will feel waking up drowsy and restless and very having a lot of headache. Now this is called sleep apnea. This is also very common, but this can be dangerous. Sleep apnea happens when the oxygen supply or to the brain goes down seriously and the person stops breathing while sleeping. Now, how do you know this? There may be someone in your family who is having this. So, the typical patient will go to sleep after dinner and he will start snoring very loudly. And for a certain time period, the snoring will stop. That means that the patient has stopped breathing while sleeping. And once the brain stimulates the patient to wake up, and the patient again starts snoring loudly with a gasp and again starts snoring very loudly. So this is very common. This can happen at all ages. It can affect infants also, and it can affect adults also. Now there may be nasal issues. The patient might have a blocked nasal congestion and a deviated septum. There may be having a large tonsils, and adenoid gland may be large. This is the gland behind your nose. Or the patient may be having a low jawline or a very short neck. Now, how do you get tested for this? You can go for a polysomnography, also known as sleep study. It can be done in the lab or in the hospital setup also. And there are other investigations which can be done, such as nasal endoscopy, laryngoscopy, echocardiography, ECG, and thyroid profile. Now, there are various managements which can be done to check for sleep apnea. There may be lifestyle modifications needed, and there are certain devices such as CPAP or BiPAP machine which force air into the lungs, but this requires a consultation by healthcare professionals, and there are certain surgeries also which can be done to improve your airway. Thank you.